Post-EMDR self-care. This video is on EMDR, which is a therapeutic technique used to treat trauma. I'm Karen, a holistic psychotherapist, and I bring you videos on holistic well-being so that you can live your most optimal life. EMDR stands for eye movement desensitization and reprocessing technique. It's used for trauma, big traumas and small traumas. Think of big traumas as sexual abuse or witnessing war, witnessing someone dying, or small traumas like not getting the job or threats to your self-esteem. So this technique is used to treat all kinds of trauma and is really, really effective. Actually, it's the most evidence-based treatment to treat trauma. And that means that it's the treatment that has been the most researched and proven to be effective at treating conditions of trauma, particularly post-traumatic stress disorder or PTSD. Before going any further, please consider subscribing to my channel by hitting the subscribe button down below. And while you're down there, go in the description box where you'll find your post-EMDR self-care checklist. I really would like you to have that checklist so that you can, the next time you have your EMDR session, have that so you can prepare very well for in-between sessions or right after your EMDR sessions. There are things that you can do to make it a little bit easier. Also, if you have already been doing EMDR and are kind of a little lost as to how did I take care of myself after EMDR sessions, that checklist will take care of you. Oftentimes when we go through a trauma, what happens is the memory of the trauma gets locked in our information processing system, which is our brain system that processes information. So a trauma gets locked in the information processing system and unable to process fully. And that's why when we think of the trauma, it brings on strong emotions. So the original trauma gets locked into the information processing system like when it happened. So triggers can be things like sounds or smells or certain music that was associated with the trauma might just trigger a traumatic response for you and experience hypervigilance, a highly exaggerated startle response, and things like that. So what EMDR does is with bilateral brain stimulation, it unlocks the memory from your information processing system and allows the memory to be processed fully. So by bilateral brain stimulation, that means stimulating both sides of the brain while following the EMDR protocol of questioning. And so different therapists do that differently. Some people use eye movements, so you would just follow the therapist's eyes. With your eyes, you would follow the therapist's hand this way as you're processing your trauma. Or what I use is I tap on the person's knees. So it's a gentle tapping on the person's knees as I go through the EMDR process. Other therapists use hand stimulations, so the stimulation will happen in one hand then the other, and that stimulates the brain bilaterally as well. Other therapists use an up and down motion that seems to also work as effectively. So it doesn't really matter, I believe, what technique you use as long as you use one that you're comfortable with. There are some counterindications to EMDR. If you're suicidal, EMDR is not indicated. As well, if you're dissociating, EMDR is not indicated. So you must not be suffering from any dissociative state or multiple personality disorder or suicidality. That it's just not indicated. And that's because EMDR actually is very, it's hard. I won't lie, it's hard. It brings on strong emotions. It is draining to your energy. A lot of people feel tired afterwards, even for a few days. And so you really have to have good coping skills to be able to handle the effects of the EMDR on your mental and physical health. And so it is important to really work on increasing your coping skills before engaging in an EMDR practice with your therapist. Build your coping skills. So how do you deal with strong emotions? Perhaps you start a meditation practice or yoga practice. Just really build good coping skills so that those practices can take you in between the EMDR sessions, because EMDR is taxing on your system. It really is. So the reality is EMDR is difficult, it's hard, it's taxing on you physically, emotionally, and spiritually. And that's why having a post-EMDR self-care is very important to help you sort of be able to take care of yourself and soothe yourself and get back to a state of wellness. What can you expect during your EMDR session? If you work with me, I would come close to you by sitting in front of you so that I can reach your knees and tap on your knees. What would happen then is I would ask you to close your eyes, and we'd go through an exercise called the safe place exercise, which is where we identify imaginarily where your safe place is, so that at any time during EMDR, if too strong of an emotion comes up, we can go back to that safe place exercise and soothe your system. And so I come close to you, I tap on your knees. At first we identify your safe place, and then we begin the EMDR process of its particular questions that I would ask. There's not much talking that happens during the EMDR session itself. It really is designed so that your brain does the processing itself without much talk. So I follow a protocol where after a series of tapping, I ask you to take a deep breath and then tell me what you experienced, which then you tell me what you experienced, and I'll find a nugget of healing that is needed to be healed, and I'll say go with that, with whatever you've identified in your previous statement or experience. I'll say go with that, as I believe it's going to lead to healing. And so more tapping happens, and then again after some time I'll say take a deep breath and share with me what you experienced, and then so on, the process continues. So there's just not much talking that happens. It really is mostly tapping. What to expect after or immediately after your session is that you'll feel tired, but you will continue processing for weeks and sometimes even months post EMDR. So it's really, I call it sometimes magical what happens, because it really works deeply and over time. So even if you think like not much happened during the session, just trust the process and see it unfold. I do recommend to my clients to keep a journal of insights and dreams, because you will be processing through your dreams and throughout the day as well. So anytime you get some insight or a new way of seeing the situation or a new memory shows up, please write it down and then bring that to your therapist the next day. Bring it to your therapist at the next session. It's also preferable to schedule your EMDR sessions when you don't have to return to work afterwards. So schedule them if you work a 9 to 5 at the end of the day so that you can just go home. And now we'll talk about post-EMDR self-care, as this is the subject matter of our current video. So if you haven't yet downloaded the post-EMDR checklist down below, please go ahead and do that now, and so you can follow along with me. So the first thing that I want you to do post-EMDR is to keep your meals simple. For a few days, especially the day of EMDR, have your meals pre-arranged prior to your EMDR. So pre-plan your meals for the day of the EMDR and possibly a few days after the EMDR. That way you don't have to use vital brain energy to focus on making meals. It'll already be there, and also it'll be more simple to digest, so your system will not need to utilize extra energy to digest and process your food. The night of the EMDR session, so the night following the EMDR session. If you do have children, it's possibly preferable to arrange for childcare or have your partner handle the children if you can. This is at least so that you have the possibility to engage in soothing and nurturing practices for yourself. You will need time to rejuvenate your batteries and just really soothe yourself. Do things like maybe yoga, meditation, journaling, deep breathing, taking a warm bath, maybe a quiet walk, or even watching some light TV. But the night of the MDR is not the time to be socializing and engaging in rigorous activity. It's really about keeping it calm and soothing yourself. And so limit social interaction the night of the EMDR. That way your brain can continue processing. We don't want to do anything to block the brain from being able to process fully what you just went through via EMDR. I highly recommend that you also keep a journal of your EMDR sessions, as mentioned before, because you're going to continue processing weeks and months after the EMDR. Particularly note your insights and your dreams. If there's a common theme, or if you just get an aha moment, that would be awesome to note, and definitely bring this journal to your therapist at your next session. It's also recommended to drink lots of water. for the next few days after the EMDR session. Again, your system will have gone through a rigorous process of reorganizing and reprocessing memories, which does take a toll on your physical and emotional and spiritual wellness. And so drinking lots of water will help flush things out and keep things moving and working very well. So aim to drink half of your body weight in pounds divided by 2. So if you weigh, for instance, 100 pounds, you would divide that by 2. That would equal 50. And so you'd aim to drink 50 ounces of water a day. Next is to allow yourself to get restful sleep and to at least get 8 hours of sleep until your next EMDR session. Again, that's because you will be continuing to process, and you need to give your brain the space it needs to do the processing. So we often process via our dreams, and so 8 hours of sleep will help the process. It's also best to avoid all alcohol and drugs during the EMDR process or during the time that you're getting EMDR, and that's because substances may impact your brain's ability to continue processing. If your feelings post-EMDR or your experience post-EMDR is just too overwhelming, do contact your therapist. Absolutely connect with them, let them know what's going on. They'll be able to guide you a little bit on how to handle what it is you're experiencing. And until your next EMDR session, do engage daily in calming, soothing, and nurturing activities. And so, if you're tired of living the effects of traumatic memories and you really want to put them behind you, do engage in EMDR, but just make sure that you have the proper tools to take care of yourself post-EMDR. So I'm Karen. Please consider subscribing to my channel. Don't forget to download the cheat sheet down below, or your checklist, actually, your post-EMDR self-care checklist, and connect with me on my website at karenjohnston.life or via Instagram at holistickaren. Talk to you later.